Rosena Allin-Khan, hello, how's it going?
Hello, brilliant. It's always good to see you, Ollie.
Likewise. We'll talk about your brief mental health in the context of the pandemic, but first, let's start with this story around PPE contracts.
Yeah.
Huge sums of money expended by the government, and now we have this massive stockpile. We might not even use it all because I found out that PPE can actually expire. I mean, can you begin by explaining, as a doctor, how that's possible? Like, how can a mask expire? It's just a piece of material, isn't it?
Well, anything sort of degrades over time, doesn't it? So if you think of some of your clothes or your gloves or anything that you have sitting around for a long period of time, material can just sort of degrade. So when you look at the things like masks and gloves are made out of, they do have a long shelf life, they really do. But if they haven't been used, they do eventually start to not be as effective as the gold standard would want them to be. And so yeah, and we do hear that a lot of expired PPE was available, which is why this Herculean effort never actually amounted to anything.
Yeah, so I mean, there's a lot to unpack in this. Primarily, probably the concerns that some people may have profited from the pandemic, and more specifically around these government contracts. I mean, presumably you're concerned about that. You're looking into that. Tell us about it.
Yeah, well, actually, just last week, I asked the minister during health questions to categorically assure us that no Tory donors are profiteering from the pandemic after reports emerged of a company with links to Tory donors getting £190 million in government PPE contracts. The minister obviously refused to answer. Matt Hancock was sitting next to her, shouting at her as to what to say to me. She completely dodged the question, and people don't want to see huge sums of public money needlessly sprayed on spin doctors or management consultants. But more importantly, Labour is calling for an inquiry into how lobbyists and their clients benefited from vital information about lockdowns and public policy before the public knew. It's a scandal. And back in July, Labour was asking the National Audit Office to investigate this matter. And it's vital that the government is transparent. I mean, how unconscionable is it to think that there are people who profited out of this pandemic, which caused so many people to lose their lives, including our frontline NHS and care workers who were supposed to be going to work protected so that they could also protect us?
We'll talk about these lobbying groups in a moment because it's an interesting part of the story. But just on for the moment on PPE, I mean,
Yeah.
the response will come back from the government that there was a global shortage of these products. They were left really with no choice other than to spend huge amounts of money because the need for them was so dire. They were acting in extraordinary circumstances and did the best that they could. I mean, do you not accept that argument?
Well, let's just break this down for a minute, Ollie. The price of an FFP2 mask bought by the government increased by almost 1,400% in just 6 weeks to the end of May. Gowns increased by almost 350%. I welcome all efforts to procure PPE, but I have concerns that we might not be getting a fair price. And one company, PPE MedPro Limited, was given government contracts worth over £190 million. They had no previous experience. Coincidentally, they were only set up, Ollie, on the 12th of May this year. And reports have suggested that this company has substantial links to Conservative Party donors. So, of course, people are going to think to themselves, these companies hiked up prices, benefited from government contracts. Are we getting a fair price? Are the public getting a fair price? This is public money at the end of the day. And last week, the National Audit Office revealed that £10 billion worth of contracts signed outside the normal procurement rules is what we saw. Now, of course, we welcome all efforts to get the PPE that we need. And yes, it was a global pandemic that nobody could have foreseen. But some of the hikes in prices, which I've just outlined, and links to the Tory party, are just quite scandalous and need a full investigation, and there has to be transparency because the public rightly have questions.
It's interesting. I did an interview with Peter Gagan, who talks about really how little money actually someone needs to donate in the grand scheme of international politics to be able to curry favour with political parties. I think something like £50,000 a year gets you sort of 4 dinners with the Prime Minister. Where you think about money in the US, you're talking about millions of dollars. But just on that point, sorry, it's would you agree that there's kind of like a balancing act almost between sort of having competitive tender, so the prices are fairer, there's a bidding process, versus the speed at which the government was looking for these things to come through? Because if you do have that competitive process, you're slowing it down, aren't you? And I suppose the trade-off is, yes, we pay more, but in the short term, we get PPE quicker, which obviously is for the benefit of the health service.
But we know that there were companies that were experts in producing PPE. The government didn't even go to them, didn't even give them an opportunity. We're talking about companies that were created in May, hiking up the prices and having links to the Tory party. I mean, I smell a rat. This definitely is not something that looks as though we should just roll over and accept it. And at the end of the day, look, of course it was always going to be difficult. And I know people are sick of politicians, like fighting with each other at a time of national crisis. But I think it's really important. Like, I wouldn't be doing my job, the Labour Party wouldn't be doing their job if they didn't say, hold on a minute. If you didn't go to some companies that were experts in making and providing PPE, you went to companies that were just set up at the time that the contracts were needing to be made available with no previous expertise. You hiked up the prices and you just so happened to donate to the Tory party. I mean, it needs a full inquiry and real transparency. And that's my take on it.
Speaking of party politics, are you going to support the government's coronavirus tier system when it goes to a vote in the House of Commons?
Well, I think as long as it's evidence-based and there is transparency, look, we've always said as a Labour Party that we want to work with the government. We want to do what's best for our communities, but we always want the science and the transparency behind it to be made available. Look, we want this to work. We want people to be safe. So ultimately, if it makes sense, if there is good transparency there, as long as people know what it will take to come out of a particular tier, then of course we will support it. But what we have seen play out this last year has been places like Leicester in a permanent state of lockdown almost, with no idea as to when they were going to come out, what the criteria were for exiting their lockdown restrictions, their tiered measures. So we will support the government when there is evidence, when it is transparent, what is driving their decisions. But ultimately, we have to make sure that everyone's safe.
It's interesting to hear you say that. I mean, the reason I was asking actually is because Sir Keir keeps issuing these ultimatums, but the government really hasn't fixed the myriad problems in what I personally, you don't have to describe it as this, but I would describe it as a clusterfuck of a pandemic response. At some point, you've got to come good on that threat, right? At some point, like the ultimatums lose their weight if you're not going to hold their feet to the fire or withdraw your support. I mean, do you think has there come a point where that needs to happen?
Well, I think we were very clear when we called for a quicker, short, sharp circuit breaker. We pushed and pushed for that. We have been doing things like pushing for free school meals. At the end of the day, we are in opposition. It is frustrating. There is only so much we can do. But I know that, Sir Keir Starmer and the Prime Minister have been in conversation. The Prime Minister made it clear this week that they've been in conversation, and we have to see how some of this plays out. I don't believe we'll know until tomorrow what the tiered system may look like. But look, you may know, Oli, if you've seen anything about my social media and anybody that follows me in any way at all, you'll know that I've absolutely no problem in holding the government to account all day, every day. And when it comes to putting our communities first, and particularly when it comes to fighting for their mental health, look, we've been asking for a national wellbeing guarantee. We've been asking for like the Minister for Mental Health to meet with me to discuss strategies to keep our communities' mental health better. Each time it's met with a refusal. So part of our job in opposition is just to keep on going, asking the questions, pushing and pushing, and that's what we're doing.
Okay, let's talk about mental health then. So loneliness peaked at its highest level since lockdown began at the start of this month. What would you like to see done to change that?
Well, first of all, I think there needs to be cross-party working. I mean, quite frankly, what is really disappointing is when very calmly asking the minister very respectfully to work cross-party, meeting with a response that says you have to try harder at the next election if you want to inform policy. Quite frankly, that's an embarrassment to the government. And what we've been calling for, is a winter wellbeing guarantee from the government for the last month. It's now late November. Why haven't we seen anything from the government? You're exactly right to say that loneliness is peaking. You're exactly right to understand this, that, the same things that I do, that self-harm, eating disorders, all of that is going up. The Centre for Mental Health said that as a result of this pandemic, up to 10 million people are going to be needing to seek support for their mental health. 8.5 million adults, 1.5 million children. That is a huge amount. And it's going to be a tough winter, but it wasn't inevitable that people would be suffering the way they are, Ollie. People have lost their jobs, their careers have been described as unviable. I've held roundtables where people are in tears because they don't know what their future holds. And government ministers have marched into the chamber saying that they need to retrain, that their careers are unviable. They have to understand what their words mean. And we also know that our young people have been greatly affected, and some of the most vulnerable are losing out on being referred to mental health services when they need it most. So it's really a catalogue of disasters that has led to the point where we are now. It is a refusal to acknowledge that our frontline NHS and care workers needed our Care for Carers plan and to meet and discuss it. It's a refusal to acknowledge that there are up to 10 million people that are newly going to need support as a result of the pandemic, and not acknowledging that people who already suffer with mental illness aren't being able to access the support that they need. All of these things together cause a perfect storm, and we know the government simply hasn't been engaging with the sector. I did an FOI, I came to the House, brought receipts that said that the government, in the first 3 months of lockdown, the Health Secretary hadn't met with a single mental health trust or charity. I mean, they soon went running and tried to meet with a few more after that. But at the end of the day, they haven't been engaging with the sector. And when I talk to the sector, they say that the level of engagement has been poor, and it's showing their lack of engagement. And it's simply unbelievable that during the pandemic they would choose to ignore the nation's mental health. And I would actually describe that as being unforgivable.
I mean, yeah, we can poke holes in Nadine Dorries all day. I think I don't think it takes much. What I'd like to hear from you is sort of what you'd set out to do differently. Like tell me about the winter wellbeing guarantee. I mean, what things would you, if you're in that position, if you weren't a shadow minister, you're in the government, what would you be doing around mental health to make things better for people?
Well, firstly, we would have put our Care for Carers plan in place, which is the policy piece that I was working on and launched early in the summer, talking about giving our frontline NHS and care workers who will be suffering now with PTSD and all of the resultant issues of working through the pandemic, giving them the support that they need. But it's also about saying we can't do anything without robust data. We know that we have fake suicide stats at the moment. It's alarming, and obviously organisations like Samaritans are doing a fantastic job at trying to make sure there isn't alarm where it isn't needed. But we need the government to take suicide prevention seriously, and we need real-time data. And that's one of the things that we're saying as part of our wellbeing guarantee. We have to do things in an evidence-based way. And we see other countries who collect data, they talk to people within the sector, they talk to people themselves who are suffering with their mental health, people who are at risk of suicide, and they provide tailored programs to help. Look, we know that so many people that engage with joe.co.uk are young men, and we know that suicide rates in young men have been on the rise for the last few years, and it is alarming. And we've had 2 million days lost to mental ill health in the NHS during the first wave alone. Suicide rates are on the rise. They're the highest they've been for 2 decades. Between 2017 and 2019, there's been a 17% increase in suicide rates. And the data we have is pre-COVID. It's vital that there is a suicide prevention strategy in place. And I think everyone, Ollie, is sick of warm words. And you're right to ask me, what would we do differently? Because mental health shouldn't be a political football where someone says, you're not doing enough, and someone says, yes, we are. It's about saying what would we do differently, and collecting the data, engaging with the sector, engaging with the people that are actually suffering. That is really, really key, but also acknowledging that we've got to put the resources in the right places, and also understanding that one of the main drivers of mental ill health are the social inequalities that we see, are adverse childhood experiences that we see, where children don't have access to free school meals, they go to school hungry, they live in insecure accommodation. It's understanding that actually improving the mental health of our nation is a holistic approach that looks at the preventative measures, the drivers of mental ill health, and then making sure people have the support that they need when they're suffering the most.
I'm glad you mentioned the suicide data there, because we've seen some misinformation, as you mentioned, actually flying around this topic, and there was a totally unfounded statistic about suicides tripling during the lockdown. And the key thing is, as you mentioned, there's no evidence to show that right now, because the data, we don't have it basically during this.
Don't have the data, and that's really important. But one thing I would like to say, Oli, is that for anyone watching this, it is okay not to feel okay. It has been a tough time. Your feelings are legitimate, whatever they are, however you may be worried or however you may be feeling. Reach out. There is help available for you if you are feeling lost and alone. And if you are having thoughts that frighten you, there is help out there. So please do pick up the phone and call people like Samaritans. They're only too willing to help.
Yes, and I would argue it's probably not a very good use of their time to be dispelling all of these unfounded statistics. Finally, I think I know your answer to this, but a word on bullying in the workplace, which can have very serious consequences for an individual's mental health. Should Priti Patel have kept her job?
No, she shouldn't have kept her job. There should be no place for bullying and harassment in the workplace. And this is why people lose trust in the establishment. What they've gone in and done is to protect her. And she should have been kicked out, quite frankly. That's how I feel about it. And how can we have any trust in the government putting forward policies on anything to protect us if they don't protect the very people who are going into work every day to make our country better to live in? And to have a Home Secretary that goes into the workplace, uses the sort of language that we have heard that she's used, talk to people in that way, but more fundamentally have opinions about other people that are like that. I mean, this is born out of her truly believing the things that she says. I mean, she needed to have been gone a long time ago.
Rosena Allin-Khan, thank you very much for your time. I appreciate it.
Thank you very much, Oli.